Hey guys, welcome back to my channel, The ENT Resident. Today, I'll be starting a series of videos on a topic, and that is tonsillectomy. Today, in the first part of the series, I'll be discussing about what is tonsillectomy and what are the indications and the contraindications of tonsillectomy. You can also now purchase my notes. I have added links in the description. Okay, let's get started with our topic. So, what is tonsillectomy? Tonsillectomy is a surgical procedure for removal of palatine tonsils. Now, the next question, and which is a very, very, very important question, because anytime you get a case of tonsillitis, the next question in terms of management, you will be asked about what are the indications of tonsillectomy. So let's get started with indications of tonsillectomy. So there are absolute indications, then there are relative indications, and then there are some indications where you perform tonsillectomy as a part of another surgery. So first let's discuss about the absolute indications. The most common indication is recurrent infections of the throat. And there is a criteria that we have for deciding how many infections of the throat needs to happen for us to consider doing tonsillectomy in that case. And this criteria is known as Paradise criteria for tonsillectomy. Now, what is Paradise criteria? It states that a child is eligible for tonsillectomy if they have had minimum frequency of sore throat episodes, which can be more than equal to 7 episodes in the past 1 year, or more than equal to 5 episodes in the past 2 year per year, or more than equal to 3 episodes per year for the past 3 years. This is the minimum frequency of sore throat episodes that need to be there. Now, what do you quantify as, or rather, what do you classify as a sore throat over here? Is, say, the patient's parents come to you and just tells you that my child has had 7 episodes in the last 1 year, please do surgery on the patient. Will that count as it, or what evidence do you require? So each episode of sore throat has to be documented. And what will it include? It has to include sore throat and more than one of the following. Now, there are 4 conditions over here. There can be either fever more than 38.3 degrees Celsius or 101 degree Fahrenheit, cervical lymphadenopathy, which can be tender or the size can be more than equal to 2 centimeter, presence of tonsillar exudate, or positive group A streptococcal culture. These are the conditions that you need to find, and they need to be documented for it to be counted as an episode under the Paradise criteria for tonsillectomy. So, this was our first indication and the most common indication. Next indication is peritonsillar abscess. Third is tonsillitis, which results in febrile seizure. So, in infants, this is very commonly seen in infants or even in younger children, where tonsillitis can lead to the development of febrile seizures. Fourth, hypertrophy of tonsil, which can cause 3 things. One is airway obstruction, which is a case of obstructive sleep apnea. Second, difficulty in swallowing. And third, interference with speech. Whenever a hypertrophy of tonsil is causing these 3 complaints, and that time you should consider the case for tonsillectomy. And the last absolute indication is when you have a suspicion of malignancy. In this case, an excisional biopsy is performed. Usually, a unilaterally enlarged tonsil can be a lymphoma in cases of children and an epidermoid carcinoma in cases of adults. So, these are the 5 absolute indications for tonsillectomy. Next, coming to the relative indications. There are 4 relative indications. One is diphtheria carriers who are not responding to antibiotics. Second is streptococcal carriers because they can be a source of infection to others. Third is a case of chronic tonsillitis with bad taste or halitosis and which is unresponsive to medical treatment. And lastly, recurrent streptococcal tonsillitis in a patient with valvular heart disease. So these are the relative indications of tonsillectomy. Last category of indications are when tonsillectomy is performed as a part of another operation. So there are three such examples. One is palatopharyngoplasty, which you perform for a case of obstructive sleep apnea. Second is a glossopharyngeal neurectomy. Here, we remove the tonsil first and then the glossopharyngeal nerve is severed because glossopharyngeal nerve is one of the structures which are seen in the bed of tonsil. Now, a very common question you'd be asked here is what are the structures of the tonsillar bed? I have a separate video which you can totally check out where I have demonstrated how to remember the structures in order in the tonsillar bed. And last indication here is removal of styloid process or styloidectomy in Eagle's syndrome. In Eagle's syndrome, basically the styloid process is elongated. It causes a lot of pain. So the treatment could be a removal of the styloid process. In that case, tonsillectomy is also has to be performed to reach the styloid process. So these are all the indications of tonsillectomy. There's another question in terms of indications, which is what are some indications that you know for unilateral tonsillectomy? Because usually in all cases we perform a bilateral tonsillectomy. So is there any indication where we perform a unilateral tonsillectomy? Yes, these are excisional biopsy in a case of suspected malignancy or ulcer on tonsil, excisional biopsy in lymphomas and tumors, tonsillar lith, tonsillar cyst, tonsillar foreign body, styloidectomy, and glossopharyngeal neurectomy. These are the indications for unilateral tonsillectomy. Coming to a last part, which are what are the contraindications of tonsillectomy? Now, there's a very simple mnemonic that I have over here to remember this, and that is remember A, B, C, D, E. So let's start with A. We have 4 contraindications starting with A. First is anemia, where hemoglobin is less than 10 gram per dl. Second is acute infection. Now, why do we not perform in acute infections? Because two things. One is we have a fear of bronchospasm when you take the patient under anesthesia in a case of upper respiratory tract infection. Second, in an acute infective case, there will be more chances of bleeding intraoperatively. So, if you have a choice, you would rather not do it in a case of acute infection. Third contraindication is an aneurysm of internal carotid artery. In this case, a very classic presentation could be the presence of pulsatile tonsil. In these cases, we should not perform a tonsillectomy because what if you end up injuring the internal carotid artery? The fourth one is a patient of age below 3 years. Now, why will we not perform surgery in a patient below 3 years? There are multiple reasons over here. First of all, because of their age, they have a poor surgical risk. Secondly, whatever is the average amount of blood loss that happens during surgery, that will result in hemodynamic disturbance leading to the need for blood transfusion. So it is better to avoid surgery in these cases. Third is tonsillectomy can result in a compensatory hypertrophy of other lymphoid tissues that are present in the Walde's ring. For example, the adenoids and the lingual tonsils. And in this case, the management of lingual tonsil hypertrophy will become more difficult to manage. And last of all, why we wouldn't perform a surgery for tonsillectomy in a case of less than 3 years old, because the defensive function of the lymphoid tissue are at its peak during this age, during this 3 to 7 years of age. So you would rather not perform surgery in a patient of less than 3 years of age. These are the 4 contraindications starting with A. Now let's move on to B. B is for bleeding disorders. Now, is bleeding disorder an absolute contraindication? No, it is not. Now, bleeding disorders can be cases of von Willebrand disease, hemophilia, sickle cell disease, leukemia, purpura, aplastic anemia, etc. So, this is definitely not a absolute contraindication. We can operate on the patient after you end up treating the condition. So, whatever deficient factor is present, we usually transfuse in the patient and then we can treat the patient. We can perform the surgery in the patient. One important thing to remember here is if we do perform tonsillectomy in a case of a bleeding disorder, it is preferable not to use the dissection and snare method, which is the most common method usually used, because this method can end up causing more injury and chances of bleeding will be more. So you try to choose a method which has less chances of bleeding happening. Next contraindication, starting with C, is a case of cleft palate or submucous cleft. We do not perform here because of the risk of developing velopharyngeal insufficiency, which is a delayed complication in a case of tonsillectomy. Next contraindication, starting with D, is diseases of systemic origin which is uncontrolled, like diabetes, cardiac disease, hypertension, or asthma. These cases are usually are anesthetic risk. So you should definitely first evaluate the patient, get their condition under control, and then take them off for surgery. Last contraindication here is with E, and that is epidemic of polio. This is obviously very, very rare. Why do we avoid surgery during this time? Because during the episode of poliomyelitis, if you perform surgery, it can have a risk of entry of this polio virus into the nerve, and this can lead to the development of bulbar poliomyelitis. So these are all our contraindications, and the mnemonic to remember this is A, B, C, D, E. Lastly, one tiny thing to know is tonsillectomy. If say you have to perform tonsillectomy in a case of a pregnant patient, the better time period to be doing it is during the second trimester. So that's all about tonsillectomy for today. In the next class, I will be talking about the different techniques of tonsillectomy or the different methods of tonsillectomy. See you in my next video.